Let me ask you a question. What would you do if you're an Oklahoma resident and you fell down and cut your foot open? Could you pick up your phone and call your primary doc? And your primary doc, even if it's like 10 p.m., could meet you where you are, or you can meet at their office, and they would actually like put stitches in your foot if you needed them. My name is Jay Vintage. I'm a board certified family medicine physician right here in Oklahoma City. And that's actually one of the things that I would absolutely be able to do for each and every single one of my patients. What would you do if like you had a primary care doc and then you had this really awful sinus infection? Could you pick the phone up and be like, hey, can you do a really quick video visit with me? Or can we have a phone conversation like right now? Or can I get into your office tomorrow? Is that something that happens to you? Because oftentimes when people come into my office or come into my office because they love their primary care doctor or they like are fine with it, except for like when they actually need them now, as opposed to scheduling out for 3 or 4 months in the future. At direct primary care, it's really kind of a different model. I don't bill insurance companies. I find that when I do that, I actually have to take on way more patients and they all compete with each other for my time. And I don't like that. So what we end up doing is we say, well, hey, when have insurance companies ever given you excellent primary care? If the answer is kind of never, which for me, I can't find a model where that actually works out quite well. And so I say, you know what, listen, we're going to just charge people like monthly, and then you guys get unlimited access to me. And that's how that works. And that means if I need to do a skin biopsy, if I actually need to teach you about medications, if we need to go down the street and do a quick little exercise at the gym or go to the grocery store and look at food labels, and that's what your appointment is for the day, I'm happy to do that. That's actually my dream job, because working in a corporate industry as a primary care physician is hell, where you work literally like 60 hours a week, and then on the weekend, half the time you're spending like charting on everybody because the insurance companies and your practice managers are making it to where in order to keep the lights on, you've just got to be seeing so many people. And if you're seeing that many people, you're giving kind of okay care to a big old group of people. I'd rather give excellent care to a smaller group of people. So if this is something for you and you're in Oklahoma City and you want to actually come on in, my name is Jay Vintage. I'm a board certified family medicine physician in Oklahoma City. And I think you should give us a try. $100 a month for most adults, $50 for kids. We kind of do everything from cradle to grave. Give us a call.